Hello, I'm Heidi Larson. I'm going to give you a quick run through today of vaccine confidence in a time of COVID. Let me just pull my slides up here. And I'll start by telling you a little bit about the Vaccine Confidence Project, which was founded in 2010. And I wanted to develop an early warning system that could detect signals of rumors and issues coming up, because I had seen in my previous role at UNICEF running vaccine communication that there was more and more there were more and more rumors and questions and concerns about vaccines. And I wanted to try to, in a sense, set up an early warning system so governments could get ahead of the curve. We realized that online news media monitoring was probably one of the better ways to go, because social media 11 years ago was not as globally ubiquitous, not as available around the world. Now that's changed, of course, and we do a lot more social media monitoring. But we also realized that you don't always know who people are on social media. And so we started what we call the Vaccine Confidence Index, which is a nationally representative survey that we run about 4 aspects of vaccine confidence. Do you think vaccines are important? Are they safe? Are you confident they work? Are they effective? And are they compatible with your religious beliefs or other beliefs, actually, because we saw beliefs played a big role. And we've been monitoring with these different forms of data. And we also do local focus groups and in-depth interviews to get more detail. But basically, we've been monitoring this around the world. A couple months ago, we published maybe it's more like 3 months ago now, we published a big paper in The Lancet, which looked at our Vaccine Confidence Index data from 2015 to 2018. And in some cases, we had data for 2019 that we discussed in the paper. And we compared, how is the world doing? Where is it getting better? Where is it getting worse when it comes to vaccine confidence? And if you can see that the dark red is the least confident in the world, and the dark blue is the most confident. So on the domain of vaccines are important, the left global map is 2015, the right global map is 2018. In the area of importance, most of the world has gone into the blue range, the confident range. We still have a bit of outliers in France and parts of Eastern Europe. And interestingly, France was and has continued to be one of the most skeptical countries around the world when it comes to vaccines, for a mix of reasons. Some of them are historical, some of them are about trust or distrust in government, which is a global phenomenon. When it comes to vaccines are effective, it's a much more diverse landscape. And as you can see, even though in general, the red has gotten lighter in the right-hand side, and there's a bit more blue, which is the more confident end. But it's a much more scattered and diversified landscape. The domain that has been the most challenging and problematic is confidence in the safety of vaccines. Many countries, as you saw, will say vaccines are, sure, their vaccines are important, but then when you ask the second question, are they safe? They think twice, and some of them are not confident. And of course, it depends on which vaccine. And that's where the issue of COVID comes in right now, because it's a very new vaccine, and that has created quite a bit of anxiety among people about, do we really know if it's safe yet? It is, by the way. There's been an abundance of research on that. Otherwise, it wouldn't be made available to the public. But this is on the left, you can see again 2015, and on the right 2018. Now, overall, there's been a bit of a lightening of the dark red. But if you can see that Africa is mostly bluish on the left, but you start to see more and more of the yellow and even orange in Africa on the right. And you should also notice Australia, which was in the blue range in 2015 and actually has become more skeptical about the safety of vaccines. It's these changes, it's these trends that we are particularly focusing on. And one of the phenomena we see is that with language diasporas are sentiment diasporas. So the part of Africa, for instance, that's changed is mostly Francophone, French-speaking Africa, and probably exposed to a lot of the more skeptical media and online discussions on vaccines that might be coming from France. So when it comes to vaccine confidence around the COVID vaccine, we've been running surveys since actually last summer, even May, June. And this is a global survey in 17 countries between the 10th of June and 22nd of July. Again, here, the dark blue again is strongly agree. Going to the darker orange, which is the very dark orange, is strongly disagree. Sorry, the arrow here is in the way. So where I put the arrow here is about where Australia would be based on the latest data I've seen. And that's somewhere in the middle, with DRC next to France being the most skeptical about the COVID vaccine. They are acutely, there's a lot of anxiety and distrust in the COVID vaccine in DRC in the face of Ebola outbreaks also. And actually are more accepting of the Ebola vaccine because they've had Ebola in DR Congo for 40 years. So it's a much more familiar disease. They're much more conscious of why a vaccine is important. Right now, some people don't even believe that COVID really exists. And it's pretty hard to convince people to take a vaccine if they don't think the virus even exists. So moving ahead to December, because one of the things we've seen is that public sentiment changes over time, and sometimes it's quite volatile. It's a bit like political opinion polling. This is a different mix of countries, some of the same, but 32 countries. Dark red is definitely will not take a COVID vaccine, and this is a kind of a different shade of blue-green, definitely will take a vaccine on the right-hand side. And again, I just put the arrow where Australia, based on the more recent data, would be situated in this hierarchy. Well, the other arrow on this page, on the right-hand side, points to government handling of the COVID pandemic response. Because in addition to these 4 or 5 key questions we ask, I say 5 because sometimes we ask specific questions about a vaccine. So we ask the general questions about confidence and safety, importance and effectiveness and beliefs. But then we additionally ask about COVID vaccine, flu vaccine, MMR, depending on why and where we're doing research. But in addition to that, we're also asking a lot of questions about who are the people that we're serving, the gender, the age, the education, employment, their overall health, and their confidence in government. And as you can see, to the right of the center line are how strongly these issues correlate with acceptance of a vaccine. So we see that the perception that the government is handling COVID well is the strongest predictor of them feeling confident that they'll probably or definitely take a COVID vaccine. So overall handling of the response is crucial. But these national averages mask a lot of variations. Here, this is a recent paper from Katie Atwell and her colleagues. As you can see, gender plays more of a role with COVID than it does with flu or even childhood vaccines, which has been quite interesting. I suppose that's not a total surprise because gender has played a role in who gets more serious illness and death, actually. And we do see that, particularly with older men, the mortality and serious illnesses have been higher among men than women. That's changed a bit in the second waves, but that could be part of the reason that women have been more hesitant to get a flu vaccine. But gender is one aspect that matters. Ethnicity and race are also playing a key role, as we've seen in many places in the world. The minority communities have suffered the most in terms of illness and death related to COVID. And that's also partly because of access to services, maybe distrust in government, not believing the control measures, maybe not even believing COVID really exists. As you can see here, this is from surveys run in the US, that white adults are the least likely to believe some of these concerns, that they might get COVID from the vaccine, that COVID vaccines are not as effective as they're said to be or safe as they're said to be. We don't know about their long-term effects. You can see that consistently Black adults are the most concerned about these issues, followed by Hispanic, and lastly, white adults. This is consistent with other countries. Well, certainly in the UK, I would say it's probably quite similar in terms of the racial and ethnic divides. We're also doing a lot of survey work across Africa in collaboration with Africa CDC. This is a 15-country study from Ethiopia being the most accepting of vaccines to Senegal being among the least accepting of or predicted accepting of a COVID vaccine. They're not getting the vaccine yet, so I say predicted, but this is about their willingness to accept a COVID vaccine. That's a bit different for Senegal than their routine childhood vaccine. They're generally more positive about childhood vaccine, but there's something about the COVID vaccine that has instilled anxieties and concerns, and particularly in Senegal, there's a lot of rumors circulating. We also asked about confidence and safety of the COVID vaccine versus routine normal vaccines that have been given regularly. And the red lines on the bottom here are about vaccines in general. And you can see that the gray bar to the right of the red bar for each country is significantly higher in Morocco, in DR Congo, in Senegal, Burkina Faso, and Mali, and a little bit higher in most countries. Interestingly, except for Ethiopia, which seems to have slightly more concerns about general vaccines. But the COVID vaccine is different. It is new. It is anxiety producing. Here in Africa, we saw a different trend than in the West. Male and female were pretty similar. But then we also broke it down by sub-region, and these, as you can see in TACE, is much less willing to take a COVID vaccine than other parts of the country. That's these bars on the far lower right. And then we also looked at the comparison between Senegal and overall. So in the upper left-hand side, under key survey insights, you can see that the overall means the overall 15 countries we surveyed, the average compared to the bar on the right, which is Senegal. So the average of the 15 countries, overall, 35% believe the US caused the spread of the virus. In Senegal, it was 62%. 29% of the 15 countries believe that Africa is being used as lab rats. That's what's almost 70% in Senegal. The unsafety of trials, actually, for some reason, that was lower in Senegal and higher in the rest of Africa. But we do try to put these in the context of what are other people thinking, because that matters. Okay, I'm gonna move right along here. So on the subnational, we do look, subnational does matter because while the average might look, things are looking pretty good, when you break that down subnationally, you really do see differences. In this case, the darkest green is the more positive, and the lightest and is more hesitant. So the the northwest here, and even the central north Kano state is the least confident, and that has been consistent. They had a major boycott for 11 months of a polio vaccine. In general, we see there's less trust coming from that part of the country. So in 2018, I wrote a commentary for Nature, and they asked me, there was a lot of discussions about, are we ready for the next pandemic? We knew, the world knew we would get a pandemic, something like COVID. We didn't know when, and we didn't necessarily think it would be a coronavirus, but we knew, based on history and based on what we know scientifically, that there would be another pandemic. And the perspective I took in the number of different commentaries and meetings that were going on was, we need to be ready for what I think is the biggest pandemic risk: viral misinformation. And sadly, it has been even bigger than I had anticipated in 2018. We have had, as you have seen also in parts of Australia, but around the world, outright demonstrations. COVID is a hoax. We don't believe this. Why are you locking us down? This is made up. Pharmaceutical companies made this up. Governments made this up just as a way to control us. And really active reaction. In some countries, like in India, it was less of a libertarian reason and more of an existential one, because it was a matter of working. It was a matter of having, if you're a day worker and you can't go anywhere, it means you may not be able to feed your family. Frankly, that's become an issue in many parts of the world. One of the things I'm often asked by journalists and other people is, does misinformation really affect actual uptake of a COVID vaccine or willingness to take it? So we did a control trial between us, the US and the UK, 8,000 people, 4,000 nationally representative in the US, 4,000 nationally representative in the UK, asked everyone about their experience in COVID and would they be willing to take a COVID vaccine. At the beginning of the trial, 54% said they would definitely take it in the UK, only 41% in the US. But then we exposed 1,000 in each country to positive factual information about COVID vaccines, and to 3,000 in each country, we exposed the 5 most frequently circulating pieces of misinformation, one at a time. And then we came back to everyone and asked them again other questions about COVID, within which we asked them the question, would you take a COVID vaccine? And we found that after exposure to misinformation, in the UK, there was a 6.4 percentage point drop in willingness to take a COVID vaccine. And in the US, there was a 2.4% drop, but it already was lower before. So that may account a bit for that. For those who received the positive information, there was no change. There wasn't an increase in willingness, and there wasn't a decrease. But this does show that misinformation can undermine acceptance. And in a case like this, where acceptance rates were already too low for herd immunity, even just a small percentage drop can move a country under herd immunity if they bring the national coverage rate down even a few points. So I've written a book on a lot of these issues. This is mostly stories and histories, and about the dynamics of how rumors start and why they don't go away, and how they can be really owned and believed and actually have impact on public health. It came out with Oxford University Press, and this is our website. www.vaccineconfidence.org. We have lots of resources on there. Thank you very much. Hope this was helpful, and I'm sorry not to be there for the discussion.